Welcome to Modern Management of the Older Adult, brought to you by the Institute of Clinical Excellence.
Hello everyone, my name is Dr. Samantha Chamberlain. I am a TA within the Older Adult Division of the Institute of Clinical Excellence. Welcome to the Older Adult Podcast, brought to you by the Institute of Clinical Excellence. I'm excited to be continuing my 5-part series covering the article out of Meeting the Growing Demand for Age-Friendly Care, Healthcare at the Crossroads. It was a multi-section study, and I've been going over section 1, which is the 5 forces disrupting and transforming healthcare today. We are on part 4 today. We've already covered the dramatic demographic shifts, or the age wave, the health span, lifespan gap, which I love to talk about, the fragmentation, high cost, and inequity in healthcare, and that brings us to part 4, healthcare workforce shortages. This is something we are all probably far too familiar with, and we saw it really skyrocket during COVID and just people just really struggling to stay in healthcare jobs just because of the mental and physical burnout, fatigue, whatever you want to call it, that occurred within healthcare during that time. And it hasn't really rebounded. People found other options, or the appeal kind of dropped off to being in healthcare. And so that has continued to be an issue. And so they go ahead and go into this. So just like the other parts, I'm going to read through this. This is a pretty short section this evening, but I want to really cover it and talk about it and start discussing ways that we can kind of this call to action that we can do to help get it better. So part 4, healthcare workforce shortages. While an aging population and a persistent health span, lifespan gap are dramatically increasing, the demand for healthcare for older adults, the healthcare system is already understaffed and facing growing workforce shortages. Healthcare professionals often feel they're running as fast as they can just to keep pace. The National Center for Workforce Analysis predicts the country will face a shortage of nearly 140,000 physicians and 338,000 registered nurses by 2036. So in over the next 11 years. That's the predicted shortages that we are expected to face. Workforce shortages further delay effective diagnosis and proper treatment and ultimately compromise the quality of care. I don't know about you guys, but in rural Oklahoma, we are seeing this big time right now. Dr. Chrissy Hell and I have caught way too many things that I feel like we probably should have been the first one to bring up with our patients. But it's not necessarily at the fault of their providers so much as it is just the shortages and being able to get them to the other specialists that they need, or being able to have the time to listen to their cluster of symptoms as opposed to just hearing, I'm dizzy at one visit, I've had this arm pain at another visit, like just all these different things that we usually get to put together because we get to spend so much time with each individual patient that we see. Continuing on, 25 million Americans already live in a place designated as a primary care healthcare professional shortage area. From 2010 to 2023, 167 rural hospitals closed or no longer offered inpatient care, and more than 400 more are vulnerable to closure. Millions of Americans from all ages are now facing long wait times for medical attention and even loss of access to primary and acute care. Had a great example of this. I have someone right now who it was going to be 5 months to get PT, and there was some work comp issues that added an additional layer on here, but the injury happened in November, and she was not going to get to be able to see someone until July. So November 2024, she wasn't going to get PT or other additional care with specialists until July, and that was west of here. And so she came back to Oklahoma to stay with her family, and she was able to get in with me pretty quickly once she came back to Oklahoma and started searching for care elsewhere because she was tired of waiting an additional, she couldn't be out of work for that long. So that's just one example, and that wasn't even in Oklahoma. That was in a state that I would not have expected, in Nevada. So just big shortages all across the country are leading to a lot of issues and a lot of delay in care. And so I feel like if she would have continued to wait till July, it just would have taken her recovery that much longer because, of course, there was lots of guarding and lots of community phobia and other things that have just been such a challenge for her. And it's definitely a case where it's like she just needed permission to move, and she could have probably been better months ago, like probably by December, January, been back to work. But instead, we're in May, and she's just not getting the care that she needs. Continuing on again, lots of tangents here. The long-term care workforce is even more dramatically short-staffed. In 2022, 87% of nursing homes reported serious staffing shortages. Think about that on the flip side. That means 13%, only 13% of nursing homes were fully staffed. That's frightening. More than 61% had to limit patient admissions. Also, those two percentages have me a little bit concerned as well, because if 87% reported serious staffing shortages, but only 61% are limiting patient admissions, imagine the quality of care that some of those places are providing. And yes, it's out of need, like at least someone's getting something, but at the same time, we've got to do better. From 2021 to 2036, the long-term care workforce would need to grow by nearly 1.5 million to keep up with demand. Growing this workforce has been exceedingly challenging due to physically and emotionally demanding nature of the work, coupled with extremely low pay, lack of training, and lack of career opportunities. There's a side quote here that I just absolutely love, and it's so important to consider. Countless times I've heard clinicians say, I treat all of my patients the same. But how do you know what matters to a patient if you're treating them all the same? If you've been around the older adult division very long, you understand that you load it, dose it, and you make it meaningful. If you are treating everyone the same way, like if every person that comes in that has a complaint of shoulder pain is getting the same program and the same interventions, you aren't treating the human in front of you. You are going through a list, and that's not the care that our patients need, and it's definitely not what our older adults need. They need you to be attentive and pay attention to them as an individual. That quote was from Karen Bullock, a PhD professor of social work at Boston College. A companion problem is the lack of geriatric competency and training. Incredibly, less than 1% of American physicians are geriatric specialists. That is about 1 for every 10,000 geriatric patients. Only 10% of medical schools require geriatric rotations, while 96% require pediatric rotations. Less than 1% of RNs, pharmacists, physician assistants, and physical therapists are certified in geriatrics or gerontology. So if you're listening, you obviously care to be better at treating the older adult. You are probably one of the less than 1% of providers that are wanting to provide higher level care to older adults. So thank you for being here. Thank you for following along with the older adult division and just trying to do better for all your patients, but especially giving a little bit more time and working on increasing your skills for that older adult population. It's greatly appreciated and very much needed. Okay, the only large-scale solution lies in training more healthcare professionals across all healthcare settings. Primary care physicians, specialist physicians, physician associates, and all types of nurses. In the rudiments of geriatrics, including recognizing and respecting the specific needs of older patients. Promising initiatives are emerging, so this is where we're starting to see a little bit of improvements and a strive for better care for older adults, but we really need to get everybody on board with them. So there's the Geriatric Workforce Enhancement Program of the U.S. Department of Health and Human Services that recently received more than $200 million in government funding toward improving how clinicians, family members, and caregivers support older adults. This includes enabling 42 university and hospital programs to integrate geriatric training into primary care. The Geriatrics Emergency Department Collaborative, or GEDC, is a nationwide initiative to improve quality of care and health outcomes for older adults in emergency departments. The GEDC provides educational and consulting services to help emergency departments implement best practices and earn geriatric accreditation through the American College of Emergency Physicians. Today there are over 500 accredited emergency departments, which is great. There's also the Institute of Healthcare Improvements, as detailed later in this report, it says, has recognized over 4,000 healthcare sites for joining the age-friendly health systems movement and introduced evidence-based interventions for all older adults in their care. The intervention systematically addresses the 4 M's, which are medication, mind, mobility, and what matters to them in terms of their health and well-being. Medications, mind, mobility, and what matters to them in terms of their health and well-being. It is about the human in front of you. It is about what respecting their wishes and respecting what they want. for their life at that time. It's not always in line with what we want for them, and we can provide the information on where we think we can get them, but ultimately it has to be what is important to them and what matters to them. So, like I said, my call to action for you guys is really, one, you're here, you're trying to better yourselves as older adult clinicians. You're trying to improve how you're providing interventions to our older adults. So the call to action is continue pursuing that geriatric care knowledge, please, and encourage the healthcare providers, the students in your network, just any of the humans around you that may be assisting with older adult care to really up their attentiveness to older adults. Not just their knowledge regarding aging physiology, like that's a great start, and that's very important for us to be able to properly screen and kind of put that cluster of symptoms together so that we know if we need to refer out or not. That's been happening a lot in our clinic, appropriately so, unfortunately. Like, it's been things that have additional providers. But just being able to listen to that cluster of symptoms, know what that aging physiology is, know those red flags, know how signs and symptoms can present due to that aging physiology, and know what you can make a change with loading patients, with getting them active, with providing the information on protein intake, with providing them with other nutrition suggestions, with sleep hygiene. You know, some people don't even know what sleep hygiene is, so providing them with that information and really helping them just dial in the basics so that their health has a chance to recover. Whether it's an injury, whether it's, chronic pain, whether it's whatever it is, whether it's balance, having these basic lifestyle behaviors on board really start to make a shift with how effective your programming is. And then, of course, being able to load it in a way that is meaningful to the patient and is in line with the goals that they have for themselves starts to make a really big impact. And just them feeling heard, like knowing that you are listening to them and creating a plan for them based on what they said to you, and that you are dialing in all these symptoms that they may have to provide them with referrals or to tell them that, hey, they may need to talk to their primary care provider about this. Sometimes that's like the biggest part of your time with them. But just really being attentive to what they're saying to you, what older adults are saying to you, what all your patients are saying to you, but then really advocating for how much fun it can be to treat this population, because, as physical therapists or occupational therapists, just anyone in the rehab and fitness world, we know that, like, right in the beginning of school, everyone's really sport focused, or a lot of people are, and that's not the primary bulk of our care. Yes, there are those sport focused clinics, but there's also a lot more of injury in older adults and even middle-aged individuals that are needing physical therapy. And if we don't know how to properly treat those people, then we're really doing ourselves a disservice within our profession, because it's a whole lot more fun when you feel confident doing, like, dosing individuals appropriately with load and meeting their goals, what they want to do. And then it just becomes so much more impactful for your career and for your purpose, and it reflects back from your patients. Your patients just really value your support and your listening skills, and the fact that you're able to take what they've said to you and turn it into a program that makes them feel better and is effective and efficient, and it works. It just works, and they're able to achieve those goals, or at least get close to them, or see hope and be hopeful. And sometimes giving people hope is the best thing we can do. So I hope that makes sense to you guys, and I hope that you are able to take this information of less than 1% of us are really dialing in our older adult care, and just help the people around you, the healthcare providers around you, the students that you get the opportunity to help guide them towards the fun side of the older adult population. It's a blast to treat and just really meaningful. If you're loving what we're giving to you on the Older Adult Podcast, I hope to see you guys at any of our live or online courses. We have Older Adult Live coming up May 31st and June 1st in Greenville, South Carolina. After that, June 7th in Aspinwall, Pennsylvania. And last in June is June 21st, Leander, Texas. So that's our next upcoming live courses that we have available. Level 1, so our online 8-week course, Level 1, starts next week on the 19th. Our Level 2 class starts this week on the 15th. So if you've completed level 1 and you're interested in level 2, this is the week to sign up. Sign up today, tomorrow, like sometime quickly. And then if you haven't done level 1 yet and you're interested in more geriatric content, please jump into that course. It is really impactful, like career-changing impactful. That's by next week, the next Wednesday. Okay? Great to see you guys. Would love to hear any suggestions you have on improving our workforce and improving our ability to treat older adults effectively and just being age-friendly.
Thank you for listening to the MMOA podcast. If you found this helpful, please share with someone that could benefit. And if you're looking for more practical content to help you better serve older adults, head over to www.mmoa.online, where you can learn more about our free resources, our community, continuing education courses, and our certification. Once again, that's www.mmoa.online. Thanks for listening.